in case you did not know. We have a bit of an outbreak of cholera in Kamukunji.
On Thursday, 5th May, the Minister of Health declared a cholera outbreak right here in the informal settlements of Motherland, Eastleigh South, Kamukunji, Nairobi County. According to CS Mutai Kagwe, the cases will not have been recorded if the residents here were adhering to the COVID-19 prevention measures, him mentioning of hand washing and hand sanitizing.
Because everybody would have been washing their hands and sanitizing and so on.
But what is the condition really like here? How is the environment here? And what other factors would have predisposed these residents to cholera infection? A very strong and suffocating smell is what welcomed us in Motherland area of Eastleigh southward Nairobi. Open sewers right in the middle of homesteads, flies on every surface due to poor sanitation. Every situation here putting the lives of thousands of residents, children included, at risk.
Namjue tu watu wanaendelea tu kuzidi kugonjeka. Kama saa hii mama sita wako hosi. Wengine wana dead, hata tujui nani yako next.
Now, cholera is an acute infection caused by ingesting contaminated food or water. The World Health Organization terming it as a global threat to public health, affecting both children and adults. And it says it can kill within hours if not treated.
I have absolutely no doubt that at the height of the COVID days, there would have been no cholera.
Kuna outbreak imetokea huku kwetu na wamesuspect wanasema ni cholera. So kuna watu wameathirika.
One key thing in the slum is that there is poor disposal of waste. There's a dumping site just next to the residentials. A dumping site which picks waste from across the larger Eastleigh. And there was also blocked sewer lines. This precipitated a high number of diarrhea cases in the area.
Hii ni kesi imekuwa, hii kesi ya cholera imekuwa, sasa jana ilijulikana juu mheshimiwa alikuwa hii area. But ni kesi imekuwa ikiripotiwa juu kuna hawa ma CHV wamekuwa wakipeleka ripoti kwa OC hapa Biafra na wamekuwa wamepeana ripoti ni cholera.
From the monitoring done by the World Health Organization's experts, Kenya has been experiencing continuous outbreaks of cholera since the year 2014. The outbreak announced by the Minister of Health in this area being one among many that have been reported previously in different parts of the country. Aware or not aware, the residents here are going about their daily activities, not knowing the dangers this entire situation poses to their health. Children playing and walking in the dirty, contaminated water, while men and women continue cooking and eating by the roadside, with this lady cleaning her hands in this dirty water. Is it really an issue of not adhering to the COVID-19 rules, or a fact that the environment here is just inhuman, unfavorable, and therefore unhealthy?
Ujue hii maji inaingia kwa nyumba za watu. Usiku kukinyesha maji inachanganyikana na sewage inaingia kwa manyumba za watu. Ukiangalia asubuhi unapata ni worms, zizi maggot zimejaa. Now most of these people hapa chini wanalala kwa godoro chini. So unapata asubuhi ukinua hivi godoro kumejaa wadudu hivi. So hiyo kitu ina spread from one place to another.
According to residents here, the open sewers, broken water pipes and the garbage has been in this sorry state for months. The situation made worse by the rains that were being experienced in the country.
Hii drainage imekuwa ikiletea ugonjwa, na tukiangalia hapa kuna drainage imekuwa hapa, maji yote ya kutoka Eastleigh South yote inaingia kwa hiki kijiji, ambapo ni maji chafu. Na hii drainage kusema tu ile kweli, kutoka ile wakati yenye ilitengenezwa hiyo drainage inafaa kushuka mpaka chini. Ilikuja na wakaachilia hadi hapo,
Sasa hiyo drainage kitu yenye sisi tungeomba, hiyo drainage maji yake yote inaingia kwa hii kijiji. Hiyo drainage ni mzuri, iconnectiwa mahali inafaa.
With dump sites such as this, sewage flows, drinking water pipes submerged in raw sewage. Now, how are residents here supposed to be assured of their health?
Diarrhea and vomiting are some of the symptoms experienced by those already affected. None knew that cholera had come knocking right on their doorsteps.
Kama huku kuna shida ya choo, choo ni moja tu, public choo moja, na si watu wote wanakujanga kwa hizo choo. So unapata bado watu wanakunia kwa nini naona mwaga kwa mitaro. Unaona bado inakosi nini magonjwa.
Lois Nekesa, a community healthcare worker, attended to a number of those who showed cholera symptoms. According to her, one of those she was attending to passed on as they awaited for assistance.
Juu kama kuna mtu client moja nilihudumia na tukamwitia ambulance kwenda kufika hivi ikakuwa mtu amepasa. Huyo alikuwa na dalili, alikuwa anasema anaumwa na tumbo, anaumwa na kifua. Alikuwa na kifua na baada alikuwa na hara.
It takes between 12 hours and 5 days for a person to show cholera symptoms after ingesting contaminated food or water. However, according to the World Health Organization, most people do not develop symptoms. For those who develop symptoms, the majority have mild or moderate symptoms, while a minority develop acute watery diarrhea with severe dehydration.
Kuna wengine wenye wametibiwa na waka recover, lakini ule wawili ndio wamepass. Huyo mwenye bado matanga yake inaendelea na ule mwenye tulizika jana.
Clean water and proper disposal of waste has proven to be a challenge in this area. The water being drunk here is definitely contaminated, for sewer water mixes with drinking water due to the leakage from the broken water pipes. Proper disposal of human waste is also an issue, indeed breeding cholera. Juliet Waithera says she lives in fear that she could be affected, the fear that more people will die if the condition here is not improved. She not only fears for herself, but every child living here.
So ukiitiwa wewe unakuja kufanya first aid. Kama sasa juzi kuna mjamaa amekufa, hata tuko tunajua amekufa na nini, kuja kujua jana ati alikufa na cholera. Na sasa hizo sisi ndio tulishinda tukimshikashika. So pia sisi inakani kama tunajiexpose kwa hiyo hatari.
A number of people like this lady have opted to deny their children of playing outside just to keep them safe. But for how long, and is it even healthy?
Ni kuchafu. Sasa nimefungia watoto kwa nyumba waesi toka jua venye kunakaa. Maji yenyewe ni shida. Hakuna maji. Watoto inabidi tu tuwafungie kwa nyumba. Si unaona kama watoto kama na venye watu huku ni kuhara kila siku mtu ni hospitali, kuna wenye wanakufa njoo hiyo uchafu.
Does a life need to be lost for action to be taken?
Wale wamekufa ni wa baba wawili na kuna watoto kama 6 na wamama kama 4 already wanatapika na kuhara.
According to the residents here, immediately the Minister of Health announced of the cholera outbreak, those involved in cleaning the area, collecting garbage and unblocking sewers, swung into action to put the place in order.
Kitu ya kwanza ni sewage. Kulikuwa na sewage ilikuwa imeblock na imekapa for 3 good months. Tumesha raise alarm lakini no action. Sasa hivi watu wamesikia mtu amekufa, sasa ndio wamekuja jana kufanya action.
Hakuna kitu imefanyika so far, ni kuchimba tu mitaro. So mkuje mconsider waseju, at the end of the day mkisikia watu wameanza kukufa hapa, mtaanza kuleta macoffins huku ati juu watu wamededi. So please harakisheni hiyo msaada.
However, the dilemma being experienced is that these residents depend on the dump site to get their daily bread by recycling some of the materials.
Sasa tukiangalia kama saa hii, sasa tuko na watoto hapa na wamekuwa wakichezea hapa, na sisi wenyewe kuongea tu ile kweli hakuna mahali popote sisi wenyewe tunaelekea. Jua nini mtaa yetu na tuko na watu hii hapa. Sasa hiyo hebu angalia, ni kuchimba walichimba na waliacha venye iko.
Watengeneze hii place yote juu at the end of the day watu wanakulia hapa breakfast, lunch na supper. Hii ni mboka yao. So wakuja watengeneze drainage sana sana, wachimbe mtaro at least yenye inapeleka hii maji direct kwa seaway.
Today is a day immediately after the CS for Health announced the cholera outbreak. As we walk in the slums to ascertain the situation, we meet Lugalia Beatrice, a health promotional officer, sensitizing the residents of the importance of maintaining proper hygiene so that the infection is contained and that no more lives are lost.
So basically we are promoting hand hygiene, food hygiene and sanitation in this area. We realize that there's a lot of waste that has been dumped here, and when it rains, all the wastewater runs into their houses. So it becomes a challenge to really take care of themselves in terms of hygiene. So we are just telling them to ensure that they are taking care of themselves, because basically we give the information, we empower them with the information they need on prevention measures, and then they take up the action of doing or practicing or taking up the practice of preventing themselves from getting infected.
A combined action should be taken to control the cholera outbreak reported here and also ensure these residents are aware of what needs to be done in terms of sanitation and hygiene.
I've done much, basically. One thing is that we have been working very closely with the community health volunteers to make sure that anybody presenting with those symptoms of diarrhea is taken to our facility. We have a facility that is less than a kilometer away, Biafra Lions Clinic. We have set the facility as a holding bay. For any cases that are presenting with diarrhea, they are attended there. And we have adequate investigation kits that can confirm this condition.
Officers from the Ministry of Health at the time of the outbreak announcement took samples for laboratory tests to help them better in developing a tailor-made situation to curb any disaster.
The residents, they have a responsibility to make sure that the kind of waste they are disposing, because they are disposing waste in a very haphazard manner. And one key thing that we have requested our community health volunteers who visit households to sensitize persons on the importance of hygiene is to make sure that they improve on their health-seeking behavior. One thing that we have noted again in this area is that people are sick but they're not visiting facility. Yeah, like we have children who are sick, malnourished, but they're not coming to the facility. So we are encouraging people to come.
Just like any informal settlement, proper disposal of waste is an issue that needs immediate address. More clean latrines are required. The need for clean water, proper drainage and sewage cannot be overemphasized to avoid cholera outbreaks.
Hii shida ya cholera imeletwa tu na hii mambo ya drainage. Ukiangalia Eastleigh mzima, drainage yote outlet iko hapa. Na hii sewage try kucomplain ifungwe mara wanafungua kama saa hii ona venye iko. Wameshafungua wameachia hivyo wasee. Na hapa ni kiwanja watoi wanakuja kucheza.
If the waste can be removed or the dumping site can be removed there, our teams can be carrying out routine inspection to make sure that in case the CHVs report a threat, it is attended to. Because we have adequate sprayer pumps, we have adequate chlorine that we can use to assist the households.
Amidst the COVID-19 pandemic, Kenya had a commendable community behavior change where people increasingly exercised hand hygiene. As a result, the country significantly reduced incidences of killer diseases such as cholera.
Sasa ile kitu wanafaa kufanya kama saa hii, hata kama sewage imefunga, dawa zikamu na kupigwe dawa. Juu already ile maji hata vile ilikuwa chafu, watu wako nao kwa nyumba. Juu walikuwa washachota already. Ile maji kila mtu wako nao kwa nyumba. Juu walikuwa washachota.
Wasee wa huku tunaweza kaa chini, tuweke kama baraza, tuwaeleze umuhimu wa ni vizuri mtu kutumia choo na umuhimu ya mtu maji kama ni ya kutumia ya kukunywa, especially ya kukunywa, watreat maji. Juu hata hizi pipes zenye ziko huku si ati zote ziko 100%, zingine zimetoboka, sewage kiblock hivi, sewage na drain everywhere. Ikidrain unajua zile maji na kwa contaminated.
Indeed, research has proven that with the public health promotion activities that came with COVID-19, cholera cases reduced. Now, as residents in this informal settlement and the public at large are being urged to be hygienic, the stakeholders involved, including the county government and environmental bodies, should take up the responsibility to ensure that this resident at Motherland informal settlement live in a safe and clean environment. My name is Aida Munzati for CAC TV, Motherland, Eastleigh South, Nairobi County.